The improving of the health and wellbeing scheme, it's about a working partnership we've got with the NHS and our KTP, which is a knowledge transfer partner.
The knowledge transfer partnership application was centred around transforming the service model from a reactive service to a preventive and enabling service.
It's about prevention, it's about preventing our tenants going into hospital and hospitals admissions. It's about being able to contact somebody who will come out and do a visit and assess as to whether they could be treated at home.
I start off in the morning doing my morning calls to everybody via an intercom, and once I finish the calls, if anybody said they're not very well, I would go up and have a look and see how they are and make a decision really on whether to call the doctor out or the emergency care practitioner, whoever I feel that they need to see.
We've met the housing officers and as a service our team can be contacted by the housing officers if they're concerned about any of their residents. We actually do a full clinical assessment and obviously if they have an illness that needs treatment, then we actually do that diagnosis and then we commence the treatment straight away as well. So it's kind of quite an invaluable service to the residents who are housebound as well, who don't actually get out for the prescriptions.
The illness I had was like a heavy flu type cold, almost like influenza, and it really incapacitated me. I had aches and pains, I had a sore throat, I had a runny nose and congestion. So I was pleased that the practitioner came to see me because I was really floored. I could hardly stand. I really was very, very poorly.
Older people don't want to go into hospital just in case they pick up any more bugs when they're in there really. They want to be in their own home. So, any service that we can provide to keep them there, keep their health and well-being, it's got to be a good service.
The population of people living in sheltered housing schemes is sort of ageing rapidly. So what we do know about that is that at least sort of the majority have 3 or more chronic conditions. So there's a lot of comorbidity.
Elderly people are on a high risk category, risk of the falls amongst other things, and I think because of the ECP and for the art coming out into the schemes, visiting people, it prevents all sorts of problems occurring.
I've got problems walking and sitting and cooking things like that in the kitchen. I used to carry 3 things from the kitchen to the sitting room in the morning, one at a time. I've got to walk with a stick, I'm using my left hand in the house. So the shelter house, I rang the service up. They came and saw us, 2 therapists came. They brought us, they got us a trolley to carry things from the kitchen to the sitting room. Instead of making 3 journeys, make 1 journey. And I've got a seat in the kitchen so I can sit down when the kettle's boiling and things like that and make the services soon now.
There's a lot of people within our schemes who've got no family and the only person that they've got is really their sheltered housing officer. So I think it enables them as well to stay with the tenant for a longer period, waiting for the ECP and getting treated home rather than either having to go to hospital either in an ambulance on their own or having to go in a taxi on their own.
For example, somebody that is suffering from dementia, taking somebody out of their home in that familiar surroundings can actually disorientate them a lot more and exacerbate what's actually wrong with them. So if we actually come out to see the patients at home and get them examined and find out what's actually going on and treat them at home, it prevents that.
If you sort of address what's happening in someone's life. So if you optimise their access to wellbeing services, so if they know where the community groups are for sort of looking at dietary needs, how to access schemes such as hop to the shop schemes or the befriending schemes that exist in the community, we can optimise wellbeing.
There's lots and lots of time being saved now where you've got your sheltered housing officer who are unsure, they don't know what to do. They don't have to phone me anymore and say, what can I do, Linda? It means I can work on other projects and that with other partners. And it means they've got somebody to talk to and it reassures them and it makes their job just so much easier being able to pick the phone up and get some advice and guidance from both teams, the ART and the ECP.